I'm Roger Paul. I'm a trustee of Bone Cancer Research Trust, and for the last 5 years I've actually been chair of the trust. Its roots stretch right back to 1998, when an individual who lost his son decided to raise money and start getting research into primary bone cancer started. This then compounded, and another 8 families joined him, and this was through the auspices of Professor Ian Lewis, who was a paediatric oncologist at Leeds, and they came together in 2004 and agreed that they all wanted to be involved in research. And to do that, they decided that what they would do is actually put together a charity, and Bone Cancer Research Trust became into being on the December 2005, and then it was registered as a charity in March 2006. So up to 2005 they had actually funded something around £159,000 worth of research, and then they decided that they could do a joint effort would be far superior to going out as individuals, and therefore Bone Cancer Research was born in 2006, and as they say, the rest is history.
Primary bone cancers are highly malignant tumours that arise in the bones, often of teenagers and young adults, so they differ from other bone cancers that you might have heard of, like metastatic breast cancer. They're very serious because they are highly malignant and they often affect young people. There's major types of primary bone cancer are osteosarcoma, chondrosarcoma and Ewing sarcoma. They are serious cancers, they are life-threatening in some patients, and it's very important that we pick them up early in order to give people the best chance of good treatment and cure. So the symptoms of primary bone cancer are usually pain. Pain can be intermittent, it can come and go, and it's classically present at night. Although musculoskeletal pain can come from a lot of sources, we do encourage people to at least think about the fact that primary bone tumours exist, not just in teenage and young adults, but also in older patients. And we'd suggest that if you're a physiotherapist or a primary care practitioner seeing a patient with a musculoskeletal pain, you take a good pain history, you examine them, and if you're not sure what's going on, you take an X-ray. If you think a patient has or is suspected of having a primary bone tumour, then you should refer them under the 2-week guidance to a bone tumour diagnostic centre. In England there are 5 centres where patients with primary bone tumours are seen to make a rapid diagnosis. There's one here in Newcastle, one in London, one in Birmingham, Oxford and Oswestry. In Scotland the arrangements are slightly different. But we'd encourage early referral because it's very important to get to the bottom of it quickly. Treatment for primary bone tumours should be delivered in a specialist centre, and there are a number of treatments depending on what kind of bone tumour you have. These include surgery, drug treatment and radiotherapy. We appreciate that primary bone cancers are rare. There are only about 600 cases per annum in the UK and Ireland, and it's because of that that we're trying to raise awareness of primary bone tumours through the development of an e-learning module with the Royal College of General Practitioners. We've tried in this module to let people know what signs and symptoms they should look out for in an attempt to raise awareness and to reduce the time to diagnosis, which we think is really critical for this group of patients.
I'm a GP and I've seen the devastating effect of bone cancer in a young person. So that's perhaps rare because some GPs won't ever see a case of bone cancer. Not primary bone cancer in a young person in their lifetime as a GP. One of the things that we've talked about is early diagnosis. And early diagnosis is early awareness. So in general practice, we're saying, keep it there in your mind, look for it, examine for it, test for it. But we've also got to make sure that our patients, as young people, know that if there are things that don't get better, from a sort of musculoskeletal point of view, that they also need to come and keep coming so that we give them a satisfactory answer.
Bone Cancer Research Trust has evolved since 2005, 2006, beyond all expectations, and today we're the leading provider of funding for primary bone cancer research in the UK and Ireland.
The BCRT has done some wonderful work in, increasing people's awareness, and there are lots of pieces of information that you can get that you can work through yourself. And if that then makes you concerned, then that's great, because you can bring that along to your GP and stick it under his nose. We love it. It just draws our attention to that possibility.
Bone Cancer Research Trust will continue with its key objectives, which is to improve the outcomes for all patients as we go forward. This we will do through funding research, providing information, creating awareness, and supporting patients and families as we go forward.
Late diagnosis means poor outcomes. Poor outcomes is a pretty insensitive way of saying that this affects, people's lives. People die from this disease, and the consequences can be devastating. So if we can pick it up early, deal with it quickly, we're likely to save lives and save much unpleasantness and morbidity for people and their families.
In the last 30 years, the outcomes for patients have not improved, and therefore the number of people dying as a percentage of the number of people that get this disease has remained the same. So the outcomes have not improved at all. So there is still a huge opportunity for Bone Cancer Research Trust to go out and commission research that will ultimately change that profile. And that is our key objective going forward.
Over the last 9 years, we've funded 49 different projects into primary bone cancer, totalling £2.3 million, which has meant we've become a leading research organisation into primary bone cancer. Our vision is to build and promote a scientific community engaged in primary bone cancer research. It's a less common cancer, but it's no less important. We invest in 3 major areas: cause, cure and care of primary bone cancer. Examples of our research include looking at fluoride levels in drinking water and comparing this to the incidence of osteosarcoma and Ewing's sarcoma. Another exciting example is the development of biomarkers for personalised treatment for bone cancer patients. And we've also invested into raising awareness amongst newly qualified medics to keep primary bone cancer on their radar.
I'm Dr. Zoe Davison. I'm the National Biobank Facilitator for the Bone Cancer Research Trust. So I'm delighted to join the Bone Cancer Research Trust for this exciting new initiative to develop a national biobank of primary bone cancer samples for use in research. The aims of the project are to develop a network between the 5 centres, to make samples available for researchers in a speedy way, and to develop an interactive patient registry. One of the major hurdles for researchers in this field is there's a lack of samples available for research into primary bone cancer. So this project aims to address this and to make more samples available. This will really drive forward research in this field.
From 2004, when the original 9 families were brought together by Professor Ian Lewis, everyone is still a supporter of BCRT. Many are still contributing towards the funds at BCRT, and 2 of them are still and remain trustees of BCRT as we go forward, because as you can see, there's a longevity. Once our supporters come on board and they're involved, they're pretty well hooked for quite a long time, which helps us in generating funds and spreading the messages out to other people who have become affected over periods of time.
So when we look back at the last 10 years, it's really important to acknowledge those founder people, those first groups of patients and parents who came together because there was nothing happening. They couldn't and wouldn't accept that. And that's something we must really remember as a part of our heritage. And going forward, we're going to build on all that they've achieved. The key areas of work for Bone Cancer Research Trust are to continue to grow the research that we do, build that scientific community, bring together the people who are doing it in different parts of the country, and really grow a strong network that can bring all that together and move us faster forward in a bigger way. We need to be in the national conversation about cancer research. We need to be there fighting the corner for a less common cancer that is no less important, because the diagnosis is devastating. And the truth is that more people die of the less common cancers, and that's what we've got to do. Get in there and fight that and make sure people are aware of it. We've always been really proud of the information that we provide, high quality information, up to date for anybody affected. And we're constantly growing and developing that, and that's something we're really dedicated to doing. We don't want anybody who's facing a diagnosis to feel isolated, and that's what we're here for. Raising awareness about primary bone cancer is also vitally important. Getting the right information empowers people. They have more knowledge, and that means the patients or prospective patients who are going to a doctor's surgery to say, could it possibly be this? That's important. We have that information there for people to consult. But also working with all the health professionals, including GPs, so that they're more aware of what the symptoms are, because it's important to discount primary bone cancer, and you've got to be aware of what those symptoms are. That's our role, and we're going to be working very hard to continue to raise awareness, because early diagnosis is vital. Primary bone cancer is a less common cancer. It means that it's been low on the pecking order for monies into research, but that's changing now because of Bone Cancer Research Trust and all that it's achieved. And we want to continue that growth. We want to empower people with information. We're not able to change the diagnosis, but we are here to tell you you're not alone, and that's important.